5 out of every 10 couples who are struggling to achieve pregnancy, the concern will be from the man. That is a very significant proportion. And it doesn't mean the remaining 5 out of these 10, the concern is from the women. No. Women only contribute about 30%, and the last 20%, we just don't know what the cause is. It's called unexplained infertility. But we don't talk about the man. We don't talk so much. We don't put so much emphasis on the contribution a man gives to achieving a successful pregnancy for many reasons. And you see many men who are struggling to get a lady pregnant, and all they are just taking is supplement, binging on supplement, but no one has investigated. So in this video, I explain the real causes of a delay in getting pregnant that is caused by a man. So I want you to pay a very close attention. Hi, my name is Dr. K, and I talk fertility, safe pregnancy, and female reproductive concerns. So you're welcome here. If you've never been here, I want you to like, share, subscribe, and comment. So what are the real causes of male infertility? The thing is that many people concentrate on causes that affect the testis itself, but it's way more than that. And that's why when you see people binging on this supplement, they are giving them things to increase their sperm count. It's not really that. Because the real causes of male infertility are categorized into 3 broad categories. Now, for the testis, which is the male reproductive organ, to work properly, it cannot work on its own. It has to wait for directives from a higher center, and this higher center is the brain. So the brain sends signals to these testes to perform its function properly. So if these signals are not properly sent, then the testis is not going to do its work. So the first issue that causes this are issues from the brain. So if the man doesn't send those hormones, the man's brain, if he doesn't send those hormones, LH, FSH, if there's an issue with the glands in the brain of that man, a pituitary gland. So in that case, the man might be having things like double vision, one hand might be weaker than the other, some of these things. But if it's just a hormone imbalance, he might not even have any symptoms. So if you don't check it, you might not know it. So hormones and issues with a gland in the man's brain called the pituitary gland, these are things that can reduce or affect that signal that the brain sends to the man's testes to perform its normal function. And what do we need to do? There are hormone replacements. They call them analogs. So if that's what the case is, then the man can be given some of this. If it's an issue with the pituitary gland, then we need to find out what it is and then treat it. Very important and not very complex, but nobody checks this. The second broad category are issues from the man testis itself. So the brain is sending the signals, but the testes are not just responding for some reason. And this is one of the commonest causes. What are the common things that can cause this? Number 1, if the man has infections in the past, highly neglected. One of the commonest infections that people don't even talk about, because all what people know is chlamydia, gonorrhea. They can affect the man's sexual potential because they are sexually transmitted infections. But one that people ignore is called mumps. You had that swelling in your jaw, mumps. Now that same infection can affect the testes. It's called mumps orchitis, and it can hamper the ability of that testis to function well. So other causes include undescended testes. The testis that is meant to be in the scrotum. Sometimes you check the scrotum, it's not there. It's not there. In fact, some small boys, some of you have little male children, try to examine their scrotum, ensure that the 2 testes are there. And if there's any concern, go to the hospital and let the doctor examine properly. So sometimes the testis that is meant to descend from their tummy into the scrotum after they are born, it doesn't descend. It remains in the tummy. If it remains in the tummy, it cannot perform its function. Because there's a reason why the testis is in the scrotum and not in the tummy, because of temperature. It cannot survive high temperature. Other reasons include steroids. Men who take steroids for muscles, it can affect your testicular function. This is very important. Other reasons include heat exposure. Men that expose themselves to a lot of heat can affect the function of the testes. For undescended testes, there are surgeries that can be done to just bring it down. Very simple. And one very important reason is what we call varicocele. Varicocele is when the veins around the testes are big and then they retain blood in them, and then the blood is so warm for the testes. Testis doesn't like a warm temperature. Then it starts to affect the testicular function, sperm count, and sperm motility. This is really important. Now, The brain has produced its signals. The testis is working well. But why is the man not producing quality sperm? This brings us to the third reason, and that is blockage. It's called post testicular causes. So that sperm is fine, but it just cannot be produced. And what are the some common causes? Now, there could be a blockage of a pipe called the vas deferens. The vas deferens is the one that brings the sperm from where it is to the exterior. If there's a blockage, then you don't get quality sperm. You don't get quality semen. The other reason is, for some reason, this pipe that brings it is just absent in some people. Some people were born with it. They do not have a vas deferens. Commonly in people that have a condition called cystic fibrosis. It's a genetic disorder. Other reasons why the sperm will be okay and it will not be produced are things like retrograde ejaculation. That's what they call it. So when a man ejaculates, he ejaculates and it pours out. But in some people, they ejaculate and it flows back. So that's an issue. And some people that have erectile dysfunction. So they are not able to initiate or sustain an erection. And for some reason, just few seconds or few minutes after an erection, okay, they go really flat. So these are some of the reasons why men could have this problem. If a man has erectile dysfunction, there are so many ways to treat it, medications that could treat it. If he has retrograde ejaculation, then he need proper assessment by a team of doctors called urologist. If the man has a blockage of the pipe that brings the sperm, that blockage can be released. So there are many things to check. So a man should not have sperm issues and then we are just binging them on supplements and we have not investigated whether it was issues by the signal from the brain or issues with the function of the testis itself or issues with the outflow of that testis. These are three broad approach that we should be using to check men that have sperm problems. Thank you for watching. I hope you've learned something. Let me know in the comment section what you think about everything I've taught you today and what you know about male infertility. Take care.